let's look at the preventative measures that are being taken to combat COVID-19 in AP House. Many students live in AP House, so everyone must follow these protocols to ensure that every resident remains safe and healthy. Please listen carefully and take notes if necessary. Now let's look at the university's requests for how you should spend your time. Daily life in AP House is very different from living alone in an apartment in the city. In AP House, one person's actions can significantly affect the safety and peace of mind of many other people. Everyone needs to be aware of this fact. It is your duty as a resident of AP House to monitor your health closely. This slide explains the Health Questionnaire. This questionnaire is for all AP House residents. By monitoring everyone's daily health and taking appropriate actions when necessary, the university will be able to maintain a safe living environment for all of you. Everyone must take their temperature twice a day, once in the morning and once in the evening. Next, you will access the designated website, enter your temperature for the night before and the morning of that day, and answer a few questions about your health every morning before 8:30 a.m. Announcements will be made every morning at 8 a.m., so do not forget to complete the questionnaire. Also, please remember to complete the health questionnaire even when you are not at AP House. Entering your information online is easy. First, enter your name and student ID number. Then select your temperature results for the night before and the morning of the submission from the pull-down menu. If you are feeling unwell, please answer the questions about the symptoms you are experiencing. The questionnaire should take about 1 minute to complete. You can also request to have a consultation with the health clinic. Please avoid taking your temperature immediately after taking a shower or bath, eating, or exercising. Your temperature will increase after these activities, so the reading will not be accurate. If you are sweating, you can get a more accurate reading if you wipe your armpit before taking your temperature. Next, let's look at what you should do when you have a fever or are not feeling well. If you have a fever of 37.5 degrees or higher, or you are not feeling well, please stay in your room as much as possible. Please do not attend classes, go out, or overexert yourself. Students living in buildings E2 and R2 can still use the communal showers and bathrooms. Your room phone is the easiest way for the university staff to contact you in an emergency. Please take a moment to make sure the phone in your room is connected properly. If you have a fever, do not feel well, or are concerned about your condition, you can contact us until 5:30 p.m. on weekdays. But the contact method for weekday evenings after 5:30 p.m., weekends, and holidays differs. If you develop a fever or start to feel unwell on a weekend or during the night, please call the AP House security office from your room telephone. We would now like to explain how you can keep dorm life safe by adhering to infection prevention etiquette. The first measure is mask wearing. COVID-19 spreads through droplets and direct contact. Droplet infection occurs when the virus, which is expelled together with a sneeze, cough, or saliva, is inhaled by someone else. If you sneeze without a mask on, your droplets can travel between 90 and 150 centimeters. The dorms have shared spaces, like the floor kitchens, which are conducive to the 3 Cs. It is especially important to wear a mask when these spaces are crowded, or if you are gathering in these spaces with your friends. The next measure is hand washing and gargling. The biggest cause of COVID-19 and other viral infections is contaminated hands. If you get into the habit of regularly washing your hands, you can remove viruses and bacteria. Meanwhile, gargling keeps your throat from getting dry and prevents infection by washing away any viral or bacterial particles in the mucous membranes of your mouth and throat. Making this part of your daily routine can also help prevent the common cold and influenza. The next measure is disinfecting your hands with an alcohol-based sanitizer. COVID-19 enters the body through the mucous membranes of your eyes, nose, and mouth. Using an alcohol disinfectant is highly effective. We have placed disinfectant stations at the dorm entrances and in the floor hallways. Be sure to thoroughly disinfect your hands. This slide talks about the 3 Cs. Dormitories, however, have shared spaces that are highly conducive to the 3 Cs. Be sure to exercise caution when you gather with your friends. Due to the pandemic, you are asked to refrain from visiting your friends' rooms and visiting other floors. But if you must go, be sure to wear a mask and disinfect your hands at one of the disinfectant stations. Furthermore, as for your rooms, you are asked to avoid large gatherings, ensure proper social distance when you meet people, and ventilate regularly. You must understand that we are in a pandemic and act properly for the sake of everyone in the dorm. Please stay safe and be considerate of your dorm mates. The last measure we will introduce is regular ventilation. Viruses do not spontaneously appear. They are carried by people. Therefore, regular ventilation is essential to ensure the safety of dormitories and the many people who live in them. Indoor air can become stagnant, especially in winter. So you must make a conscious effort to purify indoor air by letting fresh outside air in. When you're using the floor kitchen or are in your room, be sure to ventilate for 2 minutes, once every 30 minutes. This next section explains RAPID, the health monitoring system at the entrances of APH1 and 2. This system has been designed to prevent the spread of COVID-19 in the dormitories.
皆さんこんにちは。この動画はラピッドの使用方法と目的を説明した動画です。ラピッドとはエントランスに設置された感染予防のための入場管理システムのことです。ラピッドは寮生の入隊常時に一人一人の健康状態を把握し、迅速に対処することと寮内侵入者の管理が目的です。それではラピッドの説明動画を開始します。
マスクを着用してください。
検温をする際には必ずマスクを着用してください。マスクがない場合は管理人室でマスクをもらう必要があります。
正常な体温です。
ここでポイントです。AP ハウスに入る際のみ ID カードをカードリーダーにかざす必要があります。検温が完了した後に ID カードをかざしましょう。 AP ハウスに入館後すぐにアルコールで手を消毒しましょう。これも感染対策の一つです。それでは使い方を復習しましょう。検温をする際には必ずマスクを着用してください。マスクがない場合は管理人室でマスクをもらう必要があります。検温終了後、ID カードをカードリーダーにかざしてください。必ず外出する際には ID カードを携帯するようにしましょう。AP ハウス入館後すぐ、アルコール消毒液で手を消毒しましょう。各フロアでも消毒液が設置されているため、こまめに消毒をしてください。最後に重要なポイントを説明します。必ず1人ずつ検温し入館してください。感染予防対策のため、両替生の AP ハウス立ち入りが禁止されています。マスクを忘れたときは管理人室で名前を記入し、マスクをもらってください。上記の写真にある通り、熱検知の結果が3種類用意されています。熱が 37.5 度以上ある場合は、管理人さんの指示に従ってください。対面授業を受講している場合、37.5 度以上の熱があると、授業に参加することができません。授業を欠席する際には、アカデミックオフィスのウェブサイトで欠席届を提出してください。この動画は以上になります。感染予防対策をしっかり行い、素敵な AP ハウス生活にしましょう。
The university is following the guidance of infectious disease specialists to implement a zoning strategy to prevent the spread of COVID-19 in AP House. These different zones will help everyone realize the various levels of danger that exist in our daily lives. There are 3 zones: red, yellow, and green. The red zone indicates a higher risk of becoming infected. The yellow zone indicates a moderate risk. The green zone is where you're safest, but preventative measures should always be taken. The yellow zone extends from the hand sanitizing spot just inside the entrance to the hallways on each floor. This zone includes communal areas such as the lobby, kitchens, and study rooms. The green zone, or safe zone, extends from the hallways on each floor to the inside of your room. When you are in the yellow zone, please continue implementing the usual preventative measures, such as thoroughly sanitizing or washing your hands, avoiding the 3 C's, and adhering to proper cough etiquette. When you are inside the green zone, please wash or sanitize your hands thoroughly, gargle, and disinfect those items that you have brought with you from the yellow and red zones. Now, let's look at the rules for staying overnight outside the dorm. If you plan to be away from the dorm for even just one night, you must submit the itinerary and contact information form to the AP House Security Office. Before you leave the dorm, complete this form and give it to the AP House Security Office along with your room key. You also need to let the RA on your floor know that you will be gone. There are a few precautions you should take in your daily lives. First, to reiterate, avoid using the floor kitchens when they are crowded, and remember to ventilate the kitchen regularly. Please take measures to avoid gathering in the kitchen for long periods of time with your friends. We need everyone to cooperate with these measures. Next, a few points about your room. Be sure to disinfect your hands at the disinfectant station in the safe zone before entering your room. If you are gathering with your friends, remember to social distance. Wear a mask and ventilate your room regularly. Also, Please refrain from eating in your room with friends because these kinds of gatherings can lead to droplet infection and clusters. The usage of some of the common spaces and recreational facilities in the dorms is currently prohibited or restricted. Please check the Student Office homepage for information before using any of these spaces and facilities. Please note that the Security Office staff will warn residents if they are not avoiding the 3 C's or not social distancing. Residents who receive warnings sometimes claim that they did not intend to engage in such actions or that the way in which they were warned was inappropriate. Please remember that one person's actions can affect many others, and that these warnings are meant to keep you and everyone that lives in the dormitories safe. Your safety and the safety of every resident is the university's top priority. There are several places on campus where students can go for support. If you know what services are available beforehand, then you'll know where to go when you need help. Please remember, you do not need to keep your worries and anxieties to yourself. The university staff are always ready to provide you with the support you need. Finally, if you need to consult with the health clinic, please email them first. Thank you for watching this presentation. If you have any questions about the measures to prevent the spread of COVID-19 in the dormitories, or anything else, please email the AP House office. Once again, thank you very much.